Good evening. My name is Jeliane Vazquez. I am credentialed as a registered nurse with the certifications of ACLS, PALS, TNCC, ENPC, NVCIS, and NIHHS. My specialty is the emergency department where I have worked over 12 years, and I am also bilingual. My education career began as a licensed vocational nurse in 2008, where I proceeded to go back to school and complete my associate's degree in nursing and a registered nurse license in 2013. I returned back to school in 2018. I am currently in the process of completing my bachelor's degree in nursing. I am a part of a couple committees that I am passionate about. I am in the Shared Governance Hospital Committee, where we use evidence based practice to make changes to the hospital productivity, throughput, medications. I am also in the peer review committee where we join as a team and figure out solutions for why things happen in the hospital, for bad occurrences, or for mistakes that were made during our care. I'm also part of the critical care committee where we find ways to improve the delivery of critical care and find ways to improve the health of patients during our critical care assignments. I am also a member of the Emergency Nursing Association. The following will be the objectives that I believe I met in the bachelor's degree nursing program at Lamar University. The first objective is the humanity and society construct. This objective involves practices safe and effective holistic patient-centered care to a variety of patients' clients in multiple settings from a global perspective by incorporating theories and evidence-based findings. This objective was met for me in the nursing course 4620, Nursing Practice, Care of Patients with Compromised Multiple Health States. The assignment was a practicum reflection. The purpose of this assignment is for the student to interview a patient with a compromised health state and develop a plan of care and based on current evidence. Select a disease process similar to a disease process in the memoir you are reading. In this assignment, I chose the patient that had a TBI, a traumatic brain injury, who needed a full plan of care with many resources. Once completing this assignment, I was able to develop a plan of care that fulfilled the patient's needs financially, physically, and emotionally. I believe this objective was met at an outcome of 100%. The next objective was lifespan health continuum construct. This refers to the support of patient clients in preventing disease, maintaining wellness, promoting and restoring health, and advocating for death with dignity. This objective was met in the nursing course 4550, Practice Leadership Management Healthcare System. The assignment was healthcare delivery. As a nurse manager, you are asked to intervene with the patient and his family. The nursing staff is concerned that the adult children of the patient do not allow the patient to do anything for himself. This patient always has someone at his bedside who does all the care and refuses to allow the father to do anything, including feeding himself. The family's behavior is out of the cultural belief in caring and respecting their elders. As the patient has had recent cerebral vascular accident, you know that self-care is a requisite to healing. How will you intervene in a cultural competent way? In this assignment, I intervened in a scenario where the patient's family was not allowing the patient with recent deficits to recover his independence. Through culture sensitivity and therapeutic conversation, I created a plan of care to intervene to allow this patient to return to his independent baseline and still maintain the family's involvement. This part of the objective for me was met at 100%. The objective was also met in the nursing course 4550, Practice Leadership Management Healthcare System, in the other assignment of Nursing and Healthcare Environment. Here, you search the internet for disease management programs and choose a chronic disease that is represented in these programs. You are to identify if insurance companies, managed care, government, pharmaceutical companies, or private companies sponsor these programs. You are to choose one of the programs and explain what is the process for referral. Is the program accredited? Are RNs used as case managers or program coordinators? What standardized clinical guidelines are used in the program? And are they evidence based? This objective in this assignment, I introduced the Humana Congestive Heart Failure Program. In this assignment, I reviewed the research for resources available through various programs for the chronic conditions. This seemed to be the one that stood out the most for me. This outcome was met at 100%. The next objective was evidence-based practice and clinical reasoning construct. It involves synthesis, clinical and judgment in nursing practice, utilizing critical thinking, nursing process, research, and evidence-based practice. This was met for me in the Nursing Course 4391, Evidence-Based Practice and Nursing Inquiry. It was through the online discussion of the first assignment where you read the scenarios and write a posting on the two scenarios. You were to identify the ethical principle that was violated, discuss the principles that were violated, including the discussions and what measures the researchers could have gone to avoid the violations of ethical principles. In this assignment, I was able to find how unethical medical practices used to be and how important it is for nursing to deliver care through, more than anything, evidence-based practice. I felt that this outcome was met at 100%. The next objective was patient-client centered care, where employ safe, effective, patient-centered care using theories and evidence-based findings in collaboration with patients, clients, and members of the interprofessional and intraprofessional healthcare team. This objective for me was met in the course 4321, Nursing Theories in Online Education, with the assignment of the formal philosophy paper. The purpose of this paper was to explore your own philosophy of nursing practice using the knowledge gained from the study of nursing theory and theorists in a 3 to 5 page paper. In this assignment, I was able to use self-reflection when delivering care and seeing the patient as a whole, caring for their physiological needs, spiritual needs, and family needs, referencing back to a nursing theories. I felt that this outcome was met at 100%. The next objectives were professional roles construct, differentiates multiple role dimensions and practices with ethical, legal, and regulatory parameters when caring for patients, clients as a member of the interprofessional and intraprofessional healthcare team. This objective was met for me in one of the nursing courses, 4316, Comprehensive Health Assessment. The assignment was the chest pain discussion for Brian Foster. Here, you're faced with a patient in a home care, long-term care, or primary care setting. What specific assessments could you provide to determine if the patient needed to be transported to the hospital? Insurance companies are starting to deny payments on some diagnoses, and our assessment skills will become an even more imperative. In this assignment, I was able to collaborate with multiple members of the healthcare team to come up with possible diagnosis, testing needed to be able to tell the patient what possible causes could be causing the chest pain. We were able to identify many resources for the patient if the patient is not able to come in to the hospital and can see someone outpatient to avoid continuous medical costs. I felt that this outcome was met at 100%. The other part of the objective was met in the nursing course 4540, Practice Care of Communities, in the practicum assignment number 3, where we developed a teaching plan based on your community nursing diagnosis that would help an at-risk aggregate community that we chose to develop an effective disaster preparedness plan. In this assignment, I developed a disaster teaching plan for a community that has learning disabilities. The community also was Spanish speaking only and lacked an evacuation and shelter plan. The plan created included resources with personal items, food appropriate for the community needs, medications, and mode of transportation for evacuation. I felt that this part of the objective assignment was met at 100%. My 5-year plan, I plan to complete my bachelor's degree in nursing, uh, complete my CEN certification, become an RN3, advance to a possible management skill, enroll in a master's degree program, and complete the postmaster's emergency trauma care program. Thank you for listening. Have a good evening.